Well, and to add to that, there's a lot of situations that we've seen where when someone's had an impact to their head, it causes an oscillation or trauma to a more core part of the brain that's very deep to the outer cerebrum called the limbic system. And it's a part of the brain that we share with animals. It's a reptilian brain. And it's a lot about survival. My PhD work is in autism and alternative therapies, and in a lot of children that are on the spectrum with autism, they have these aggressive behaviors, but on the other end of the same spectrum, they have a lot of obsessive compulsive behaviors. What happens is the limbic system on a good day, when it's healthy, is it is our vigilance. It is our ability to be aware of stimuli that could affect us negatively. And it allows us to be able to make choices, but also have the ability to express emotion, but also to limit that expression to maybe a reasonable level, where we're not actually so angry that we're going to hit somebody. But when someone presents with aggressive tendencies, or on the same part of the brain, if they have obsessive compulsive behaviors, where they just can't, let go of a thought, or they're constantly, having to lock the door, whatever it is, even if it's not fear-based, a lot of times it's because the limbic system has been jostled and it's in a state of inflammation or damage in some way, and that is so often caused by head trauma. We've had not just children with autism, but we've seen people that have had car accidents, or people that have had injuries, concussion injuries from sports injuries, where the nature of the trauma, especially with that contra coup reaction that causes the limbic system to become jostled and irritated, and what happens is they develop these tendencies that they never had before the injury. And through the cranial work, through the integrative manual therapy, we have these wonderful, very gentle, indirect techniques to work with the limbic system to help it calm down, to help defacilitate it, so that the person has a higher threshold. They can handle more, not just the general irritation of the nervous system, which is so important sort of to just handle life, but even that trigger mechanism becomes less, so that they can be in an environment where they're less triggered. It makes me think of one client who, an adult person that had autism, and it wasn't even necessarily a head injury, but had had early trauma. And he would have severe aggressive behavior, severe. And he had Down syndrome also. He was living with his family. His father was a rabbi, very sort of up in, just community man. And the family would just not go out because their son would go into these episodes of just destructive episodes when he would be triggered. And the biggest trigger for him was people coughing. So it sort of shows you the relationship of that inner ear and that hyperstimulation of the nervous system and the limbic system all being so close together in anatomy. And as we treated him, and they were limited to insurance, so we saw him over the course of a couple of years. And he was 19 when he started. We saw him once a week, twice a week, half an hour, 1 hour sessions doing cranial work and integrative manual therapy. And not just for his head, but just the whole central nervous system, etc. And slowly, his episodes started to reduce in frequency and reduce in intensity, whereas before, when we first met him, it was a few times a day to a few times a week, to once a week, to a couple times a month, to once every couple of months, to the point where he just didn't have those behaviors anymore. And the biggest, most wonderful validation for the family was they went to the doctor during the winter because he had some kind of cold or something or other. And he was in a waiting room filled with people that were coughing. And he wasn't triggered at all. And it was just this validation for them to understand that things can change, even though someone had this issue, not necessarily from a recent trauma, but maybe something from years before. And it's that thing about rest isn't always enough. Because sometimes you can get to a certain point of healing, but your body doesn't have the help to be able to take that healing further. So you live with these chronic, but sometimes really awful scenarios. And then you start to get the right treatment for it, and you can make the most wonderful changes.